dahil baka ang inaakalang simpleng hilo na uwi na pala sa vertigo. And tonight we will find out more about this health issue dito sa Momergency. Kasama si Dr. Gerald Singson ng Manila Doctors Hospital.
Good evening, Doc.
Good evening. Good evening.
So, Doc, ano ba talaga yung vertigo?
Well, siguro mas madali kung say vertigo. Kasi lahat ng tao, inisip nila pag nahilo ka, it's vertigo.
Baka
no?
ma-vertigo.
Agad.
Oo.
Actually, pag pumunta ka sa emergency room, the most common diagnosis na bibigay sa'yo is vertigo. Normally, when you say vertigo, it's a specific set ng klase ng hilo. So, siguro around in nearly 80% of patients that would go complaining of dizziness would actually be suffering not from vertigo but from other causes.
From something else.
Oo, no?
Ano naman po ang diferensya ng vertigo tsaka migraine? Kasi parang parehas lang silang
Okay. Because with vertigo, may certain parang subset or subclass ng migraine which also causes vertigo. So, may point din yung pagsasabihin nagmamigraine ka kaya ka nahihilo. Because there's this what we call vertiginous migraine, which is a small set of people who suffer from migraine who also experience vertigo.
So, nauna po yung migraine, tas nagiging vertigo, o nauna yung vertigo, tas nagiging migraine?
Actually, they're both intertwined together. Pero mas marami yung may migraine na walang hilo.
Okay. So, yung
Sakit lang
vertigo,
ng
Doc,
ulo.
tama ba? Yun yung parang umiikot yung...
Yung balanse mo, Dok, parang talagang literal hindi ka na makatayo.
Let's say, pag sabi yung vertigo, ito yung, ang sensation mo is umiikot ang paligid mo.
Yan.
Okay.
Everything else, di ba, yung iba sabihin nila, ang hilo nila para silang lutang, para silang lasing. So that's not actually your true vertigo. But we can call it as dizziness per se.
O, yan.
Pero, Dok, hindi naman nakakamatay yung vertigo.
There are some vertigo not because of infection, let's say may infection sa tenga, and that can be a serious problem, no? Or let's say yung vertigo mo is caused by actually a problem sa brain, nag-stroke. No? So that can be
Okay. Pero walang masayang vertigo. Kasi minsan sinasabi, happy vertigo, yung gano'n.
I think
Ito yata nakaka-vertigo.
Sorry.
Dok, may question, no? Kasi dati na-experience ko siya. Kunwari, nakaupo ako. Tapos hihiga ako. Kasi syempre matutulog na ako, Dok. Pag hihiga ako, pag malapit na ako mahiga, biglang iikot yung paligid ko. So, uupo ako ulit.
Kailan to nung nagbubuntis ka na?
Hindi pa, Mars. Parang ano pa lang ako, nagtitaping ako. Siguro mga last year, ganyan. So, unti-unti, dinadaan-daan ko, higa ulit ako. Tapos may iikot na naman. Tapos upo ako ulit.
okay, so
Pero nawala naman siya, Dok, eventually.
usually if you describe yung hilo na gano'n, no? It's sometimes what you call your benign positional vertigo, which is actually problema sa tenga. No? But most of these are actually transient, no?
Kaya sandali.
Meron namang iba that will actually cause na persistent paulit-ulit, no? It's actually quite common with people with head trauma, no?
Does it have anything to do, Dok, kunwari with lack of sleep? Sobrang pagod?
No, pero may ibang klaseng hilo na nanggaganon, no? It's called cervicogenic dizziness, no? So, pero hindi siya yung umiikot ang paligid. Usually you have your neck pain, no? You have your stiff neck, tawag nila, no? Then you have this sensation na parang everything's slowly moving or parang kang off balance.
Oh, yan.
no?
So, pag naka-experience kami ng ganun, o kayo mga viewers natin, Doc, ano yung unang-una nilang dapat gawin?
Well, the first thing muna siguro is to sit down.
Okay.
Kasi if you move around and you have these attacks, you can actually get into an accident.
Alright.
No? Especially if you try to drive, you try to go up the stairs, no? So, maganda yung may kasama ka.
Yes.
No?
Mas okay po ba, Doc, nakaupo lang, hindi mo ihihiga?
Kung ano yung position na komportable sa'yo. Kasi if it's really vertigo, it's triggered by head position.
Okay.
So, if you were to change positions, may hilo ka.
Magbabago siya.
Although, may isang klase ng vertigo, which is also because of an infection, na persistent lang siya. So, when we say persistent, tuloy-tuloy lang siya.
My gosh.
No matter what you do, it just continues.
Until mabigyan ng gamot?
Yes, no? Mabigyan ng gamot or mawala yung swelling sa nerve, no?
Ito ba, Doc, will it ever go away? Kasi syempre yung fear ng mga iba na parang paano yun kung may vertigo ako o di forever na ba akong may medications for this? Or
May
paano na lang ang
maintenance.
buhay ko? Paano ako mag-work, mag-drive, and so on?
Usually, ang goals natin when we treat vertigo, well, one is to relieve the symptoms ng pasyente, yung pagsusuka, yung hilo. The other one is to rehabilitate. So there are usually your nerve. It's an amazing organ. So after the injury, it actually starts to heal itself. So with therapy or even just with treatment and simple exercises, no, that are instructed by your doctor, it can actually be treated naman. Except for certain problems, say infection or let's say you had a stroke, so it's central vertigo. That's a different thing entirely.
Ito, Doc, ano po ba itong nasa display natin sa giant ear?
So, you were mentioning kanina yung benign positional vertigo. So, we just brought this. So, this is a good example. So, in the ear, if we take this apart, so this is the middle ear. So, this is your what you call your semicircular canals. These are actually what controls balance for the ear. Okay, just one part of the balance for the entire body. So, benign positional vertigo, normally there are calcium deposits dito, no? Or calcium crystals. They stay in this part. Sometimes they get dislodged. So pag dislodged siya, it just floats around here, here. So just think of it parang glass of water. Meaning ko float ka na ice. When you move everything, everything moves along. But when you stop moving the glass, yung ice still floats a little bit. Okay, so when that happens, that little bit will cause ngayon confusion sa utak mo, sa tenga mo, at sa mata mo. Kasi your ear is telling your brain na gumagalaw pa tayo, your eye is telling you, hindi tayo gumagalaw. Then you start to get the dizziness on that side.
Nag-argue ang mga
Hindi
senses
silang
mo.
nagkasabay.
Liliit nilang yun, ha?
Yes,
Ang
diba?
laki ng...
Nakaka-affect, di ba?
Yes.
Pero
So,
sa tenga lang ba siya talaga, Dok? Hindi siya naapektuhan yung mata
Yan,
na parang
yan.
na parang lumalabo yung pipe.
that's a different form of dizziness, but generally you don't get yung parang humiikot ang paligid mo.
So yung vertigo, Doc, laging ear-related
Ear.
siya.
Most of the time, but it can also be central sa brain. Let's say nag-stroke
Yung
ka.
sa stroke,
Oo.
except for that.
Kaya dapat talaga pagka may ganong symptoms na, Doc, magpatingin agad.
It's best, especially kung paulit-ulit siya, no? Or if you feel na talagang tuloy-tuloy lang siya, it's really best that you're seen, no? By your board-certified ENTs, no? Or for immediate relief, kung let's say it happens tonight, sa emergency room.
Doc, where can they find you if kailangan magpa-consult?
I'm actually connected with Our Lady of Lourdes Hospital, in Manila Doctors Hospital. However, if it happens, it doesn't have to be just me.
Yes.
As long as your ENT is board certified, he's actually qualified to treat this illness.
Thank you so
Thank
much,
you so
Doc.
much,
Thank you.
Doc.
Dami namin natutunan.
Totoo.